We are back again, Mainline Healthy Living. We are talking with our physical therapy expert, Hina from Rebalance Physical Therapy. And we're talking about an intimate subject today that is important to many people, which is painful sexual intercourse. It's a lot more common than people realize. So set the stage for us here. What are people dealing with? What kinds of people are dealing with this? What situations,
So, surprisingly, young women in their mid-30s, 40s, and then women 50s, 60s, 70s who are still sexually active can have pain with intercourse. And there can be a lot of different reasons why, different age groups might be suffering from this. And intercourse should be a very pleasant activity. First of all,
you would hope.
Yes, you would hope.
Not necessarily.
Not necessarily, but it's surprising. We actually have young women that will come into our office and say, "Isn't it supposed to be a little uncomfortable?" And really, no. Intercourse should be pleasurable. It should not be discomfort. You shouldn't experience any type of discomfort with intercourse. So again, what we find is that many women may go and see their gynecologists or, go, have a checkup with their midwives or whoever they're seeing. And they might notice that with a gynecologic exam, it's uncomfortable. Or they may even notice that, as a teenager, that if they tried to use a tampon, it was uncomfortable. Those are kind of the first early signs that people may realize, there's something going on, but maybe it's just normal.
Well, that's the thing. You have no measuring stick, essentially. I mean, if it's always been uncomfortable, then you are logically going to assume, okay, and if you're not comfortable talking to other people, then you just are going to live with that assumption, and that's tragic.
Right. And so those are some of the early signs that you can kind of think about whether you're experiencing those things. And that means that there could potentially be something going on with there's actually muscles down there, which we'll talk about in a minute. But there's muscles down there that can be painful. And so anything entering or exiting this area is uncomfortable. And unfortunately, many healthcare providers don't fully understand that the muscles can actually be involved. And so even if sometimes you may bring this up to your healthcare practitioner or to your gynecologist, they may not give you all the information that's out there on what can be helpful to actually improve this discomfort and make intercourse much more pleasurable. And we see this is actually one of the bread and butter things that we work on a daily basis. I would say 60% of our patient caseload is working with patients with pelvic pain. Pain with intercourse is just one part of pelvic pain, and I'm sure we're going to be talking about
but it's
much
a
more
part
later.
that gets people's attention,
Exactly.
obviously.
Yeah.
Because it's coming up and it's not comfortable.
Right. And so what we basically want to tell women out there is that having an evaluation, if you've gone to your gynecologist, if you've gone to your healthcare provider, and there's nothing coming up as far as, any abnormal medical testing, but you're still continuing to experience difficulty with intercourse, then it could be that the muscles are involved. And so I wanted to kind of explain and kind of show you a little anatomy.
Switch to our other camera close up here so we can show people what we're talking about here. So, all right. So
again, this is the pelvis, okay? This is your pelvic bone, which sits right here up on both sides of what most people think of their hip, but it's actually your pelvic bone. This is your pubic bone in the front, and in the back, this is the sacrum, and here's the tailbone down here. Now there's a whole slew of muscles, okay? These muscles are called your pelvic floor muscles, and they actually attach from your pubic bone all the way down to your tailbone. So it's basically the saddle area of where you sit, where pressure goes when you ride a bike, and these are also the muscles that when you have intercourse are involved. Okay, so this is the muscles from underneath, and these are the muscles if you look inside of the pelvis. That's a lot of muscles.
Right.
There's several muscles that can actually become tight. They can become spasmed, and when that happens, they become painful. And so you can imagine if you have a lot of tightness happening, especially around these muscles that surround basically the vaginal canal, then anything trying to get in is going to be uncomfortable.
Right, you're going to get resistance.
Exactly, yeah. And it's no different than somebody having like a really tight, painful hamstring, and you touch it and it's uncomfortable. Okay, or anyone who's having head and neck pain, if you touch, many people have issues with painful neck muscles. It's the same thing.
Right.
Just imagine painful muscles in lining this area.
And I'll just throw it out there because that people have, if they have talked to some healthcare practitioners, they've gotten it's all in your head kind of, even if it wasn't stated, it was implied, right? So what is the proper response to someone who is saying such things?
Well, the proper thing is, sometimes, yes, it can partly be in your head only because you've been having this pain for so long that it actually, in some parts, it can actually affect the way the brain processes pain. Mm-hmm. But I would say in that regard, that's pretty much, for many people who end up seeing us, that's where it stops. Because most of the time there is actually a physical reason why this is happening.
It got into your head.
It got into your head. Because
but it didn't necessarily start in your head.
Exactly. So, I'm here to tell people that if you haven't had these muscles checked out by a physical therapist, then I think it's definitely worth having this examined. Again, physical therapy in the state of Pennsylvania is direct access. So anyone can actually come in and let us know that this is what's going on, and we can check this area out and find out if the muscles are actually involved and if they're painful in this area. And again, this can happen when anything from a young teenager all the way up into your 70s, these muscles can be affected. And even if perhaps you had pain-free intercourse for a really long time, but then you start experiencing
things can change.
All of a sudden, maybe you had a urinary tract infection. Maybe you had a host of yeast infections. Mm-hmm. This can actually change the way the muscles are actually working and responding. And then you can start experiencing pain with intercourse. So it can happen at any point in a woman's life. And so for us to examine these muscles, we've been doing this forever. All of our practitioners have been doing this at least 15 years.
Now, I'm also assuming, though, that this is not something that every physical therapist has been trained in, right? I mean, this is a specialty area. So, I want to make sure that people are clear that, just because we're saying consult a physical therapist, you want to consult a physical therapist who has expertise in this area. Yeah.
Someone who actually has knowledge and skill on how to treat and examine the pelvic floor. Right. So we would examine these muscles, see if they're involved. Obviously, there's a lot more that goes into our examination because you actually have to check the alignment of the entire pelvis. You have to take a full history to find out what's been going on. Mm-hmm. And then once we examine these muscles, we can actually give a pretty clear prognosis as far as how long it's going to take for this to get better. And then what other allied healthcare professionals can actually be part of this process of improving pain with intercourse. So, we collaborate with a lot of different nurse practitioners and physicians that really understand how to treat this from many different avenues. There's a lot that can be done. Mm-hmm. And so, that's something that when you come in, we can actually speak to you about and what needs to be done so we can collaborate and get you having pleasurable intercourse.
That would be a good thing, yes. Indeed. So, our bottom line is, there really is no painful intercourse that is normal. Yes. And that if there's any discomfort, you should not just be learning to live with that. There are things that can be done, and there are great experts out there that can help you with that. It's just a matter of getting people to know that and get connected with the right people. And so that's what we're trying to do here. So, Hina, thank you so much. This is an important topic. It affects way more people than people realize, because I think there's a lot of people who are just kind of thinking this is okay and thinking that they have to just learn to live with it. So you don't. And now you know someone who can actually help you with it. And again, important other thing to underscore, as you said, in Pennsylvania, you don't have to have a referral necessarily. You can actually pick up the phone and contact Rebalance Physical Therapy and have a talk with an expert and find out if it makes sense to have a consultation.
Absolutely.
So, Hina, thank you so much.
You're welcome.
Thank you all for coming back to Mainline Healthy Living, and keep coming back because we're going to have more conversations with Hina and our other experts on things that matter to health and healthy living.
Great.
Wait, before you go, one more thing. Hina has another special report that you may want to look at.
So I wrote this. It's called the Breakthrough Pelvic Pain Report. And this, again, outlines 17 tips that anyone that's having any type of pelvic pain, but again, our topic is pain with intercourse. If you're experiencing any type of pain with intercourse, this is a tips report that may help. Because if you're having pain with intercourse, you might be having pain with other things like sitting and low back pain and all those sorts of things. And this actually has some things that you can start doing to start improving some of the symptoms that you might be having. And what I also want to throw in is, if anyone watching has actually tried to have treatment or maybe had previous physical therapy treatment for this area and it hasn't necessarily improved significantly, or maybe it's improved a little bit or not fully, then give our office a call, because we can easily set up a complimentary phone consultation to see if you've actually had the full gamut of pelvic floor physical therapy and everything has been addressed, and potentially put you in the right direction, because no one should be suffering from this.
Absolutely. So contact Rebalance Physical Therapy and Hina Sheth. You can get a copy of the report, you can get a consultation on the phone, and if it starts to make sense, you can come in and actually have a consultation and figure out if you need some more treatment. So thank you so much.
You're welcome.
As you know, great source of resources here, so take advantage, folks. Mainline Healthy Living, Hina Sheth, Rebalance Physical Therapy.